A very good afternoon to all of you. Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum. We talk, do you? At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, that is Puberty to Menopause. This session features leading experts from across the country who save their valuable insights on the key health topic aimed to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Ashe Sahai with us to share her expert perspective when to seek help for infertility. I shall be sharing more about today's speaker in a short while. For the moment, please allow me to share a brief introduction of the company that is Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. IIL was established in 1982 by the National Dairy Development Board as one of its unit and was later incorporated as the company. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility of HBI was established at UT. The facility is one of its kind in India to have rolled out first varicose culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are the major player in human vaccines. Leader in ARV segment, present in across 60 countries, three state-of-art manufacturing facilities at Ooty, Gachibowli, and Gargapatla, which is commonly known as Genome Valley. HBI has forayed in the market of clinically proven wellness products and infertility ranges of hormones. Our our vision is for shaping global healthcare, spearheading the One Care initiative to innovate the product, produce market quality healthcare products, services to improve and extend life. Believe in providing affordable products with high quality through continuous technical innovation improvements to meet our customers' need. HBI has been a key supplier of pentavalent vaccines to Government of India under its universal immunization program. Yet another milestone, HBI introduced Havishar in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults, with the vision of shaping global healthcare by spearheading One Health initiative and the mission to innovate, produce, and market quality healthcare products and service to improve the extent lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through introduction of eco-friendly packaging for our flagship brand, that is Abhirap. As a part of our corporate social responsibility, that is CSR initiative, we have adopted school where IIL provides infrastructure support and basic facility, including assistance with the midday meal program in association with NDDB. Through the Gift Milk program, hundreds of school going children benefit from daily milk nutrition. We also donated oxygen generation plant to Telangana Institute of Medical Sciences and Research. These are some few highlights about IIL. For more information, please visit our website at www.indimmune.com. So, Puberty to Menopause, is one of a unique initiative where we address a wide range of topic related to women's health and well-being. We welcome today for the episode of We Talk Do You. This session is dedicated highly significant and overlooked topic when to seek help for infertility. To help us better understand this condition and its impact, we have joined today by Dr. Asha Sahai. So we will be sharing a short information about Dr. Asha Sahai after this short video clip. So let's welcome Dr. Asha Sahai with us for in this platform. It's an absolute honor to introduce our esteemed guest, this which is Dr. Asha Sahai. Dr. Sahai is a highly respected medical professional with an MBBS and MS in obstetrics and gynecology from the prestigious SN Medical College, Agra. With over 35 years of experience and dedicated private practices, she has been a pillar of excellence in women's healthcare. She is an active member of FOGSI, Federation of Obstetric and Gynecology Societies of India, and AOGD, and East India Delhi Medical Association, contributing significantly to medical community through her experience and insights. Dr. Sahai holds a special interest in high risk pregnancy and adolescent health areas where she is expertise and compassionate care have made her profound impact on countless lives. We are truly privileged to have her with us today to share knowledge, stories, and perspective. Please join me in giving a warm welcome to Dr. Asha Sahai. Welcome, ma'am.
Thank you, Satakshi, for inviting me on your this such a nice session, and welcome to all the audience also. And I think today my interaction will be of some use to most of the audience, and they can have their personal questions as well as whatever has been put earlier.
Definitely, ma'am. It will be a good and very best use for the audience to have you on this platform to share their thoughts, questions, and whatever is going in their mind regarding infertility. So, thank you so much, ma'am, for joining this platform. So, we will start with the question answer right now. My first question to you is, ma'am, what exactly is infertility and how it is medically defined?
See, infertility means if a couple who are staying together after marriage for 1 year and not using any contraceptive, and they are not able to, the female is not able to get pregnant, then we consider the patient to be infertile and ask them to come for help.
Yes,
And
ma'am.
especially if the, but in case if the partner, one of the partners is more than 35 years of age, especially the female, then this investigation should be started within 6 months, after 6 months of the marriage.
Okay, ma'am. So, ma'am, you as you have mentioned that 35 years of age and after 6 months of the medications and everything. So, that timeline is fixed, or like it could be like for the women who are in their 20s also.
No, no, no. See, basically, if the patient, the female is in 20, and the couple has been married and they are trying for a child and they have not been using any contraceptives. So after 1 year, they can go and seek the consultation from the gynecologist. What all tests are required, what is there. But in case if the female is more than 35 and they have been married just 6 months and still and without using any contraceptive, she is not able to get pregnant, then in that case the help should be sought earlier because of her age being above 35,
Okay.
not for the younger.
Yes,
They
ma'am.
can
Thank
wait
you
for
so
one
much.
year. Yeah.
Yes,
Hmm.
ma'am. Thank you so much for creating that awareness among the audiences. So, ma'am, my next question is infertility is only for a women issue or men can be equally affected? And how common is infertility among the couples today?
See, almost what we see in our OPDs is almost out of seven, one couple is infertile when we see in OPD. So it is that much common. Those will be coming in the OPD for seeking help. Out of seven couples, one will be infertile. So it is on the rise because of different so many reasons, which we'll be elaborating later on. But
Yes, yes.
definitely, we have started seeing more of infertile couples now.
Okay. So we can say the ratio is 7 is to 1 for the
Yeah.
males as well. Okay. You might be
For the
experiencing.
couple,
Yes.
yes, and if we say as the sterility in that for the female and the male, they are equally 50-50%, they will have problems. It's not that only female is responsible or only male is responsible. When we look
Yes.
at both the factors, it's almost 50-50%.
Okay. That 50-50% is like clearly seen in the daily practices of yours, ma'am, or that scenarios which we are facing today, the lifestyle we are following. So we can say that 50-50 is a fair ratio, right?
50-50 is a fair ratio because I think earlier for which all the infertility, the females have been blamed, but now more of investigation and more of coming forward of the male partners, we have just come to this conclusion that they want to also come and get examined. Before it was not that. Only it's for so many months only the female will keep on coming to get herself examined unless and until we just put our foot down that you bring your partner, then only we will be able to do something for you together.
Correct, rightly mentioned, ma'am. Nowadays, people should start visiting doctors because now it has been like from years it has been coming like a taboo that male are the
They will not have any problem
yes.
ever.
So yes, so I think that after viewing this live talk, they should know about the scenarios which doctors are experiencing in their day-to-day practices, and men should be aware about the infertility issues which they might have, and they should go and visit doctors. So my next question to you, ma'am, does using birth control for a long time cause infertility?
Yes, see, because if we see go by the definition, and after 1 year, you will seek go for the fertility treatment. But there are couples, especially in the metropolitan cities, who are, even after 3 years, 4 years of marriage, they just don't even plan to go in for a baby. After 4 years, 5 years, they will start thinking, and in between, so that they don't land up with any abortions or any other mishaps, they keep on taking contraceptive pills. So if you take the contraceptive pills continuously for longer time, definitely it decreases the fertility. And after stopping the pills, it takes time for the good eggs to form and the fertility to come back in the females.
Mhm.
So definitely, if the contraceptive pill is taken, it will have some effect on the female egg.
Yes, ma'am. So we can say that using the use of contraceptive regularly can really impact the fertility health of the women. Okay, thanks, ma'am,
Yes.
for this answer. Then I want to know, ma'am, can stress alone lead to infertility?
I don't think so. Stress alone, but definitely stress plays a major part in the couples nowadays. Most of the time, the type of working hours, the type of stress which they have in the office, everything, and lots of working hours are very very long. Like the people, they will go in the morning at 7:38, they'll come back at 8:39. The female is going into a different shift. She might be going from afternoon to evening, so there is hardly any time to
Yes.
spend with each other. So definitely, and the work pressures, meeting of the targets and things, which leads to a lot of stress mentally to the
Yes.
couple. So then I think planning for a baby comes goes very low down in the priority.
Yes. Agreed. Yes, ma'am. So, do you think that the early signs of someone might be facing infertility could be firstly the stress, and as we have mentioned, the this alignment in terms of the daily routine and everything affects hormones and hormonal cycle of a woman. So, what are the early signs and symptoms of infertility according to you?
See, early signs and symptoms in females you'll definitely have. They will be having some sort of irregular menstruation, not coming menstruation the time. Sometimes the earlier the periods were for regular 4 5 days, then they have suddenly decreased. They have become very scanty. They are not coming in time. They are delayed. Then they become sometimes painful, and especially for in the young girls who are doing night shifts regularly,
Mm-hmm.
means
Yes,
they will be going at 5 o'clock, coming at the 5 o'clock in the night. No, so their sleeping cycle is also disturbed, which
correct.
leads to a lot of menstrual disturbance
Yeah, so we
because
can
it
say
affects the
that,
hormone. Yes,
yes.
hormone cycle affects the secretion of hormones and the cyclical release of hormones in the body, and which affects the
Mhm.
natural menstruation.
So, what are the subtle signs of infertility that people often overlook, ma'am?
See, subtle signs means definitely once first the patient has to means get into their mind that okay, now we are planning to have a baby, and then definitely what we take in the medical languages, you have been trying for 5 6 months and not using any condoms, not using any other contraceptive pills and things, and then if the patient is not getting pregnant, then definitely she
Okay.
has to. Yeah.
Yes, ma'am. So, can we explain about the weight gain and loss? Is that linked to fertility issues?
Definitely, weight gain is a major issue now in females as well as males, because for the people who are working, those who are having desktop jobs, so they will be just sitting, going there and sitting in the office for 8 hours, 10 hours. Then when they come back, there is hardly any time for doing any normal exercises. What to talk about now, proper sleep and everything. So in that case, the weight gain does affect, and then it leads to definitely thyroid and other earlier diabetic conditions, insulin resistance, and so many other things.
Yes.
So, and definitely, if the weight gain is more, then all the mostly in the girls, they will be showing some symptoms of polycystic ovarian diseases, in which
Mhm.
the egg is not formed properly. So, weight gain is a major factor, definitely.
Okay. So, ma'am, what are the basic tests done to diagnose infertility in men and women?
See, basically, for the male, whenever a couple comes to my clinic, at least I tell the husband that at least you have to get a semen examination done, which is one and the most important thing, which only the male partner has to do, which is most important. If we get anything beyond in that semen examination, then we go for other definite other hormonal tests for diabetes, for blood pressure, for other testosterone and thyroid and other things. And for the female, definitely there are a battery of tests which she will be undergoing. She'll be going undergoing ultrasounds and for tests for her egg formation, other hormonal tests, and all tests for her tubes, whether they are patent or not.
Yes, ma'am. Correct. So, ma'am, is the IVF only option for couple going through infertility, or is there any other few options there?
No, no, no. See, IVF is not the only resort. IVF is, I will say, is the last resort. When the patient starts coming to us, when the patient comes to us for the first consultation, he's not offered IVF. He's definitely, he has to undergo all the tests which have been prescribed to him. Then we have to see where is the problem. It is with the female or it is with the male. And if it is definitely in both the partners, there is some problem, then both of them are treated,
Yes.
and we tell them about the lifestyle changes which they have to make. They have to make time for each other, and they have to look after their health, cut down on their weight, and proper sleep and everything, and try in the normal way with the medicines which we are giving. And after that, uh, if also, and then we take a deadline that okay, we'll try for 3 months, try for 6 months, and then there are other options that we first go in for IUI, like which is a intrauterine insemination of the semen,
Yes.
and then we are sending the patient for in
Okay.
vitro. Yes.
Okay. So, ma'am, as you have mentioned, lifestyle changes, the presence of good hormones, the routine alignment through body and through your yoga and whatever we could do to our body. So, do you think that lifestyle changes alone can improve infertility, or is there any medical help also needed for the age of almost we can say before 35 age women's?
See, if you can cut down on your diet, you can modify your diet, you can have your exercise, go to the gym, or stick to a yoga proper regime, then definitely. Otherwise, then there are so many other options. People going to the gym, people going to weight reduction clinics, and everything is available on the platter nowadays. And then you have to choose out. But definitely starting what we advise the patient that first you start, make a conscious effort
Yes,
to take out some time for yourself,
correct.
and then take out some time for your partner.
Yes,
And then, okay, then the things, if they do not come, okay, that the doctor is also always there, the IVF is always there.
yes,
But that much effort you will have to make.
correct. We should take a note of this valuable insight of yours that yes, we should take our time to work on ourselves, work on our body, and that we need to do more of ourselves so that we can have a healthy, fertile lifespan, ma'am. Thank you so much for this wonderful answer of yours. My next question to you is about social and emotional aspects. That why is infertility is still a taboo topic in many communities, and what should we do for it?
See, because in India, I think everything is a uh, point of discussion, drawing room discussion
Yes.
uh, in our society. That is why the pressure builds up on the couple. So whenever you're sitting in your friends, among your friends or among your relatives, this question is going to be asked. "Acha, okay, you've been married for 3 years, 4 years. What is happening? What is your next plan?" So it is the way the topic starts, even as soon as you see a young couple. So that's why it brings more of a pressure. But sometimes I feel that things have changed, and in the young couples, they have become more career oriented, and there are some of them who don't plan at all for 3 months, for 3 years, 4 years. They are not planning. So there isn't any point bringing too much of stress on them. First, when you come to the doctor, or you have to have an understanding with the doctor or with the family as it is, that okay, for 2 years, 3 years, we are not planning. Please do not force us.
Yes.
Then when we start planning, then okay, because unnecessarily it is going to build up the stress
Correct.
on the couple. And when you start planning, okay, when in that planning, if after 1 year you're not getting any success, then okay, you start with the treatment.
Rightly mentioned. Very right, ma'am. We should all understand the condition of the couple who is going, like what they are planning, what they are up to, if they are mentally. prepared for that baby or not. So we should think on this perspective, and then we should ask some couples about their
See,
upcoming baby.
Sakshi, if you have a audience, I don't know what sort of audience we are looking at present, because there is a variety of spectrum of patients whom we look at, and there are people who are not working. The girls are not working, and they are still in the with the rural sort of backup, or then there the fertility pressure goes on very early. And
Correct.
there are another educated girls or those who have moved on in their career, their view is entirely different and their pressures are different. So
Correct.
it has to be dealt separately. It cannot be same for each and everybody, the treatment and the investigation and the time.
Yes, ma'am. Correctly. And what we can do is, as a friends and family, is we can definitely understand the situation, and what we should, as a friend and family, we should suggest to them, ma'am. I'm asking to you as a, not as a doctor, but put yourself as a friend or colleague to someone who is facing or going through this phase of their life. What would you suggest them?
No, sometimes see there is it is all about counseling, how you counsel the couple when they come,
Yes.
because most of the time you will find that the young bride, she's coming with her mother-in-law. She
Mm-hmm.
doesn't know, and the mother-in-law keep on talking, and the girl is not able to say anything, and the husband is nowhere in the picture, so you don't know what is happening. So there has to be a change in how are you dealing with the infertile couple.
Yes.
Always I am insisting for all the audiences, for everybody, that it has to come as a joint uh, this thing technique, that both of them should come
Yes.
first, husband and wife, what you want, what she wants, and then after that we can think about whether you are thinking of having a baby or you're not having about thinking of a baby having a baby or not. And
Correct.
then the other people will keep on, let them keep on giving their expert opinion, it doesn't matter.
Yes, ma'am. Thank you so much for this lovely answer of yours. So, my next question to you is, should couples seek help earlier if they have known the medical conditions such as PCOS or endometriosis?
Yes, yes, definitely. If suppose if they have a prior, the lady has a prior problems of endometriosis, she has been having difficult periods, painful periods, and PCOS is irregular cycles plus hair growth and other problems, then she knows that it's better for her to go in for pregnancy as early as possible, so that we start the treatment for the pregnancy together with the treatment for endometriosis and things. So there are such things which cannot be treated, and then you start with for the
Mhm.
pregnancy. So the treatment is together
Okay.
for the primary condition which you are having, and we
Mhm.
have to keep in mind that we have to get such medicines that the patient will have more chances of pregnancy. Plus, she doesn't have or other symptoms of pain and things like that, and she has regular periods. So it has to be combined. So a patient who has prior these problems, they will be dealt separately and they will be definitely treated earlier.
Okay. So they should be more aware of their symptoms, signs, and their medical conditions, and they should seek medical
Definitely.
consultation as soon as possible,
Yeah.
right, ma'am?
Yeah. Yes, definitely.
So, ma'am, what are the risks of waiting too long before consulting a fertility expert, or is it necessary to wait for a full, as you have said, that wait for 5, 6 months or a year before seeking help, or there are some exceptions?
No, see, basically is the exceptions are in the case when there is problem in consummation of marriage, then the couple, they are not able to have proper intercourse, and there is lot of pain and there are ejectile problems with the male. Then from the beginning they know that the thing is not happening. In that case, definitely they have to come earlier and seek treatment for these difficulties.
Yes. So in that case, we can say that we should not wait for those a year or some couple of months more.
Couple of months, and then
Yeah.
yes, go and find out what is wrong, or
Yes.
what is it a psychological problem, or it is a medical problem, or it is a physical problem, what it is.
Yes, ma'am. Thank you so much. I hope my audiences are taking a note of this and should create aware, like take that awareness pointers which you are mentioning, ma'am. Thank you so much. And I would like to know, ma'am, how do doctors determine whether the infertility is due to male or female, or the combined factors, we can say?
So definitely, actually, all the patients they will be undergoing lots of tests, and if there is any problem in the semen examination, or the count is very low, or if there is a problem in the ejaculation, if there is problem in performance, or there is hardly any sperms coming, or there is hardly any semen coming at the time of intercourse, then all these problems like together it is a male factor. And then in the female, we have to look at when we go for the ultrasound that there are no egg formation, or if they are of not of good quality, or the fallopian tubes if they are blocked when we look at the ultrasound, or the colored x-rays and things, or if the hormonal levels are not good, thyroid is more, or there are other hormones like prolactin and things which affect the ovulation, they
True.
are uh, not in the normal levels, then definitely it is the female factor, and then she has.
Okay. So, ma'am, there any home test or application that can help us track that ovulation and infertility signs accurately? Do you know any such?
Yes, definitely. Now there are ovulation cards in the market that the patient is given, and then she has to put the urine in the middle of the cycle and see if the color comes. Then, okay, the egg is being formed or the ovulation is there and all that. But still, but they are not the treatment, or they are not the diagnostic tests. They'll just give you a timeline that okay, from this time to this time, ovulation is occurring. But then after that, if the egg is whether it is going into the ovaries or not, from the ovary, the eggs are going into the uterus or not, whether there is a tubal blockage. This all is not going to show from any over the counter test, except the ovulation cards which we get, which show you that the ovulation has occurred. That's all.
Okay. So, ma'am, does that ovulation card and pH scale thing, does that
Yes,
really, yes, does that really help?
yes, it helps in the patients who have already undergone their test and they know that the egg is being formed properly, the sperms are okay, so that they can time the intercourse for those particular days. That is there.
True,
That
true.
is how it is helpful. Yeah.
So, ma'am, how can couples prepare for their first fertility consultation, and what information should they bring?
I don't think so. I think they are just, it takes them a lot of time to come to a gynecologist as it is, talking among themselves for some time, getting ready that we have to go and tell the doctor. And then definitely we like to have their medical reports which have been there earlier if they have some their blood pressure problems or any other long standing medication, or what is their lifestyle and things. That's all. But rest of the tests we get it done.
Okay, thank you so much for that tips and what the couple should do before coming to any doctor. So, ma'am, my next question to you is what role does early diagnosis play in improving the chances of successful treatment?
Definitely, it pays. It helps. Definitely, it helps. The more time you take, the more the results will get delayed. So the
Yes,
earlier you start, earlier all your tests will be done, and you will be mentally over when once in a month or twice in a month when you're coming to the doctor, you're counseled, and you become a little more uh, alert about your exercises, your diet, and everything, and how the things should.
correct. Thank you so much, ma'am. We are towards the end of the session. So, my last question to you will be what are your three takeaways which you would like to give to our audiences, the viewers, which they like you want to share some three takeaways from this session? So, can you please let us know and enlighten us with
So
this?
first thing I'll say to all the couples that you decide first your own, it is your own life. So you have to decide first when you want to have a baby. And
Yes.
for both of you, you have to decide. It's not that my husband wants or my wife wants. That's why I have come here. So it is a mutual decision.
Yes.
Second thing is definitely if you have any medical problems, you have to just go and talk to the doctor. Please do
Yes.
not go on the line and keep on searching and get over the counter medicines which are going to harm you all the
Yes.
time. And third is please do not discuss your problems in the social media or among your friends, which are going to frighten you more as
Correct.
compared to giving you any help. It should
Yes.
come to the doctor who is giving able to give you more time, listen to what are all your queries, and then answer them appropriately.
Correct, correct, ma'am. The three takeaways is very, very insightful and knowledgeable thing for all of us. So thank you so much for enlightening us with your experience and expertise, ma'am. So now we are going to conclude the program. So thank you all for being part of the talk. Do you? We hope today's session was on informative, valuable in spreading awareness on when to seek help on infertility. Our special thanks to Dr. Sahai for sharing her time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our official social media platform. Please follow us on Twitter, LinkedIn, Facebook, and subscribe on our YouTube channel. Do like, share, and spread the word as many, including your friends, family, relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. So, thank you so much, ma'am, for giving your
Thank
session.
you. Thank you,
Thank
Sakshi, for
you.
inviting me. Thank you so much.
Thank you, ma'am. Thank you for your time. Thank you.